Many of my patients also come in straight away. You say that, I don't want fillers.
So what are the fillers? What are the ingredients inside derma fillers?
Putting too much volume on the face can actually cause unnatural facial expression.
We need a combination of treatment to target the multi-layer skin aging, not just rely on one single treatment. So that's the challenge that we face on a daily basis. Hi, Dr. Alicia.
Hi, Dr. Steve.
Long time no see.
Yeah, long time no see. Been a while, right?
Yeah. So it's always been interesting to discuss about derma fillers because we always see the trends when they're uprising. A lot of patients coming in asking for the treatment. And then recently there been a shift in the desire of the patients. So today we want to discuss more about derma fillers.
So basically, fillers can give benefit to our facial aesthetics, where we can enhance our facial features by just putting like probably a few spots that we need to enhance.
So what are the fillers? What are the ingredients inside derma fillers?
Okay, derma fillers are mainly composed of hyaluronic acid. And what is hyaluronic acid? Hyaluronic acid actually occur under our skin naturally.
Yeah.
Okay, so like in probably baby time probably stand about 70%, and as we adults probably 30%. So derma fillers is hyaluronic acid that have this property, water binding properties that can absorb water and restore the volume that we want, and at the same time it actually replenish the hydration to our skin.
Yeah, I think hyaluronic acid is something that we always see in cosmetic and skincare as well, because we use it in our serum, creams, and also our hydration mask. So it's something that we use in our industry every day. It's a not very commonly found compound. So what are the patient that is suitable for derma filler injection?
Okay, depending at what the patient expectation, what they want at the point of time. So if, for example, a younger patient that come with complaints like they want reduce the double chin, so we realize that the jawline is a bit receding, so we actually can enhance with derma fillers. And also, if let's say there's a tear trough deformity, we also can fix derma filler on it so that it have a fresh look. Okay, and also some of them will come in with lips, want to have a lips enhancement. So not only moisture, but they want a shape that is more friendly.
So what are the usual common indication for fillers?
We have two groups here. A younger group, they will usually come for nose enhancement, lips enhancement, and pointy cheek and apple cheek. So for older group, for restoration of volume, they will come for sunken temple and sunken cheek and tear trough deformity and lower skin sagging.
So usually for men, we are, especially in the Asian population, our jawline is actually a bit smaller as compared to most of the Caucasian. So then the double chin would be very obvious at even a younger age. So this is not just for men, but also for female as well. But for men, most of the time we do not want to plump up too much volume in the upper face. So a lot of time we just focus in treatment of the lower face.
Is there any like men's, they want a V-shaped face or more squarish jawline?
Yeah, so there has been a trend. So some of the men who want more masculine feature, then they will be more of a squarey jawline. Then we actually can design the shape for the men. But of course, for those who prefer more of a softer look or more feminine K-pop look for the men as well. So recently there has been some demand for a more slimmer jawline for men as well.
That's good to know. Dr. Steve, did any patient come to you say that fillers stretch the skin permanently with fillers?
I think with fillers, as a doctor, we have to also decide whether patient's skin is suitable to do fillers or not. Extreme example, if you are treating a 70 years old patient that the skin is so thin and so sagging down, then I think these patients are not really suitable for derma fillers. But in contrast, if patient's skin is firm enough and is younger, then yes, he may able to hold more amount of fillers. So there's also a thing about the sequence of the treatment. If your patient is more of the older age group, that the skin coming is a little bit more sagging, I would still start with skin tightening treatment or collagen biostimulator first to tighten some skin. and then we do some derma fillers. So this is my approach. What about you?
Yes, I'll do similar like this, and we'll advise like see which layer of the aging process, and usually I will assess which part is the which make the patient looks the most tired. Any one treatment that can fix the first impression to improve the fresh look first. So depending on the layer, like what you say, so depending on the skin layer, whether it's a skin layer saggy, then we'll do skin tightening first. If the volume loss that caused the aging, then we'll do the volume loss first.
Yeah.
So yeah, this is how is my approach.
Yeah, but the realistic thing is sometimes when you prescribe 5 treatments for your patients, they only have budgets for 1 to 2 treatments, right? Yeah, so that's the challenge that we face on daily basis. Sometimes we advise patients for skin tightening, but they say no, I just want to skip this one, I just want to do these treatments. So that's the challenge. So sometimes they might not get the best results that they want.
Yes. So this one is like the expectation. So we have to clearly tell the patient, say that since you skip 1-2 step, and the third step, this is the expectation that you would get. Yeah. So that they won't disappoint on the results that they opt to.
Yeah, so back to your original question, I think naturally if you put any product under the skin, it still will stretch the skin. Patient age every single day. So even with the filler treated 2 years ago, but because of the natural aging process, they need some skin tightening treatment. So recently there's a lot of discussion about 漫画脸 or facial overfill syndrome, or even like the pillow face effect of derma fillers. So what is your opinion on that?
Yeah, many of my patients also come in straight away to say that I don't want fillers, and because of this negative impact or negative effect of these rumors, I would say rumors. In my opinion, if let's say the fillers is placed in the correct place, it wouldn't cause this 漫画脸 and correct amount and place it correct anatomy. So yeah, so it will actually give you a more natural expression instead of unnatural expression. Yeah.
Usually I will explain to my patient about the aging in multi-layer. So we actually have to see the aging not just by filling up volumizing product in the face, because we know that fillers doesn't create the collagen as well. So as we age, because of the sagginess of the skin, we might need to do energy-based device or even some collagen biostimulator, and then place, like you say, a little amount of fillers to restore back the volume loss. Yeah, and then maybe some reshaping, then that's all. Totally avoid this putting too much of product on the face.
Yes. So with this putting too much volume on the face can actually cause unnatural facial expression, but put it correctly at the correct position, you actually get a very natural, and someone will probably think that you become prettier, but you don't know what have they done.
Yeah, I think the keyword is always moderation. Yeah, and then mix and match with different treatment, so you don't just use one kind of treatment to treat everything. So I think the discussion is rather we do not encourage or discourage derma fillers, but we actually use it in the correct amount when we need it, and then we combine with treatment just like collagen stimulator.
With my experience, patient will usually come in with the expectation of collagen stimulator and have a negative impact on derma fillers. The reason being the 漫画脸, and also if let's say we prescribe collagen stimulator, despite we explain so many things what they need, then after 3 sessions or collagen stimulator, they still can't get the volume that they want. And patient wouldn't be satisfied with the results because of the volume loss, and they do it with a collagen stimulator. And how they get this information for this collagen stimulator is through internet.
Yeah, because right now we cannot run away from the social media. So sometimes patients come in to consult, they already think, oh, don't talk to me about fillers, I don't want this treatment, but I want option B. Yeah, but they do not understand the anatomy and the multi-layer aging. So by just doing one treatment alone might not be able to give the satisfaction or meet their expectation.
Yeah, so multi-modal facial treatment should be advised to actually target on a different layer of the facial aging.
Yeah, that's what actually I do in my clinic as well.
Me too.
Yeah. Also, we need to understand that because collagen biostimulator needs times to show the results, and we also cannot treat certain area of the face with biostimulator. Example like the lip reshaping.
So dermal filler will be the ideal choice
for all these areas. Right now, there's too many products in the market. We don't even know which patient inject what product. Even in our daily practice, sometimes we do see some patient coming in with the unnatural lump and bumps, and then we find out actually the product that they use, they also uncertain about the origin of the product.
We ask what is the product. This is stem cells as well, so we don't know what are the products they actually inject.
Yeah, so I think that this is also one of the issues because in Malaysia especially, so some of our patients get injection from beauticians or uncertified doctors from overseas.
Yes, this one we encounter a lot. When we ask history about what have they done to the face, we need to get a detailed history, right? They couldn't tell us what are the products they injected, just a brief one, say stem cells or fillers, but don't know the brand.
Yeah. So the thing is, if they use a good product like hyaluronic acid based fillers, we can actually dissolve it with an enzyme, right?
Yes. We call it hyaluronidase. So when we think it's not patient is not happy with the products, we can actually dissolve it with hyaluronidase.
Yeah. Unless they are silicone based or some of the permanent fillers, then definitely we cannot dissolve it away.
That one needs some surgical removal from the to remove the silicone to revive back the natural look. Yeah.
So the main key takeaway point or the summary is we need a combination of treatment to target the multi-layer skin aging. Yeah, not just rely on one single treatment for the maximum results.
Yes, I totally agree with that. And also we also advise that patients shouldn't just they can read information from internet but not 100%. You still need a personalized consultation and let the professional doctors to consult what you really need for your skin and aging.
Thanks, Alicia, for your sharing today. I think we have a fruitful information and discussion today.
Yeah, thank you, Dr. Steve, as well, for sharing your experience and discussion as well.